One of the other things that was in the NDP platform, it talked about, I better quote this to make sure I get it right, ending PC experiments in privatization.
Right.
And the project that immediately came to mind there was the super lab facility that's been planned for Edmonton, the new medical testing lab that has been, I guess, assigned to an Australian company now. Any thoughts on the future of that project?
I've asked her for a briefing note. I really need to know where we're at in terms of the decisions that have been made and how far they've gone down the road. And also there's an appeal, I believe, underway. So it's about making sure that I have the right information to make decisions moving forward. And at the same time, we want to ensure that we offer stability to Albertans. So at this point, I can't talk about what the future might hold around that decision other than I will be reading more and more briefing documents.
Yeah, I'm sure. You saw a few of them over there.
Those binders, those are, somebody else asked what my favorite book is, and I said my briefing binder.
Yeah, a little light bedtime reading.
That's right, yeah.
The NDP platform also mentions a plan for expanded public home care. Any details on when that might happen, what it might look like?
I can't offer any right now other than, again, the confidence that we want to ensure that people who require support through the healthcare system have access to it. And I know, again, from personal experience how important it is to have home care there when you as a family member are trying to support somebody that you love and making sure that they can, in our case it was palliative care at home, and wanting to bring respect and dignity to my dad, and also have my own mental health and my own functioning supported as a primary caregiver with my mom. So we know that the people who are working in home care and do that work for the right reasons, and the people who call on home care supports are doing so because they need it. And we need to make sure that we can enter into our budget deliberations with that in mind.
Talking to a lot of people in the health system, as I do, a lot of people say that one of the biggest things that needs to happen is we need to get better primary care in this province. A lot of that primary care is delivered by PCNs. And for a number of years now, there's been talk about improving the service that we get from PCNs. Have you had any conversations with them yet? Do you envision anything on how to, I guess, get more hours, better services, more consistent practices out of PCNs in the future?
I've asked for a briefing document on that specifically. There is a section in my binder, but I do have a lot of underlying questions around their operations and want to make sure that, again, that we're providing stability to the actual staff who are working in Alberta Health, but also to the families who rely on their services. So I can't really talk about next steps at this point, unfortunately.
Do you believe in that model, the PCN model?
I am a patient at one.
Well, because maybe you have no other choice, though.
No, I think it makes sense to have a variety of services around the patient, right? You want to meet the patient's needs where they're at, and I think that there's merit in it. Personally, we'll have to look at next steps.
Maybe two more questions. We gotta rush off for another.
Can I just need a minute to do like a still image?
Yep.
As well,
Sounds good.
Maybe just to talk a bit more about seniors.
Sure.
What are some of the things that, when you look at the seniors ministry, what's your read on the state of care for our seniors in Alberta at this moment?
Well, seniors has a few different components too. Obviously, the healthcare component is a key reason why I imagine the Premier merged these two portfolios again, or why she has me managing the two portfolios of two ministries. Next week is Seniors Week, so we're going to be out meeting with a bunch of seniors themselves, as well as people working on the front lines, helping to meet their needs, and look forward to learning more about the state today, but also where they'd like us to be 4 years from now.
Okay. Building on that, what are your broad plans for consultation going forward, I guess? Are you reaching out to any specific groups in and are advocates in health and seniors at this point? Is that?
I've been doing preliminary phone calls just to introduce myself, and of course this week I've only been on the job for 4 days, and 2 of those I was in Calgary for cabinet meetings, but taking the opportunity when I am out and about in the province to make sure I'm meeting with people on the front line, people who are the service delivery individuals, is really important to me, and making sure that I'm working effectively with the senior leadership that are helping guide the system on our behalf.
Maybe more specifically, have you had any meetings with Ms. Kaminsky at all in any chance? Has that?
No, I have talked to Mr. Amrine, Carl, and I had a brief phone conversation, and we're meeting again next week. And of course, meeting with my deputy has been top priority, and her senior leadership team to help make sure I'm well briefed. Just how honored I am that the Premier has selected me to guide these 2 ministries. I know how fundamental healthcare is to the success of Albertans, and how every one of us relies on the services that we have through public healthcare to make sure that we have a great quality of life. And yeah, what a great honor it is. I look forward to serving her and Albertans in this way.
I just wanted to ask about menthol, because it was brought up a couple days ago, but it was brought up before the cabinet meeting, I believe. So I don't know if that was discussed over the last 2 days with the regulations coming into effect on Monday on the flavored tobacco.
I never liked it when ministers would say "stay tuned." So if there's a different way I can say "stay tuned," I'd like to do that. But I will be happy to talk to you about that in the future.
Can I ask a question? How was your first week?
It's been great, yeah. It's clear that there's a lot of people who want to ensure our success, and this is the first time government's changed in Alberta in my lifetime, and to be front and center of that is pretty awe-inspiring, and I look forward to there's really high expectations for our government. We will do our best to meet them all. But you have my confidence that we're working tirelessly to make sure that we are providing a stable, strong, forward-thinking Alberta, and fulfilling the mandate we've been given by Albertans. So it's been a great honor. Yeah.